Good morning. We are going to talk about pseudoachondroplasia. Pseudoachondroplasia is also known as pseudoachondroplastic dysplasia and pseudoachondroplastic spondyloepiphyseal dysplasia syndrome. When we talk about pseudoachondroplasia, it is an inherited disorder of bone growth. It is a rare genetic disease, a type of dwarfism, which is called short-limbed dwarfism, and it is characterized by disproportionate short stature, laxity or looseness of the fingers, wrist, elbows, and knees, early onset osteoarthritis, scoliosis, lordosis, and kyphosis. However, they will still have a normal facial features, head size, and intelligence. The maximum height for male is 120 centimeters and 116 centimeters for female. However, in some cases, individuals may attain the height of 4'10". Here is the clinical feature of pseudoachondroplasia. As I've said earlier, in the letter A, we can see that it is disproportionately short in stature. The curved back that signifies spinal abnormalities, the laxity in the fingers, and redundantness of skin folds. And in the letter D, we can see its normal head size and facial features. The discovery of pseudoachondroplasia is attributed to two French physicians, Drs. Pierre Marotou, a pediatrician, and Dr. Émile Maurice Joseph Lamy, a geneticist, in the year 1959. It was originally considered to be a type of spondyloepiphyseal dysplasia, which is a group of disorders with primary involvement of the vertebrae and epiphyseal centers resulting in a short trunk disproportionate dwarfism. However, by doing more research, pseudoachondroplasia is now known to be a single distinct disorder caused by mutation of the COMT gene. As for the age manifestation and life expectancy, infants with pseudoachondroplasia have normal birth parameters and cannot be distinguished from unaffected newborns. But at the age of 12 to 18 months, the first manifestation of the disease may appear as an abnormal gait called waddling. It is alike to duck walk or penguin walk. In addition, at the ages 3 to 5 years, disproportionate shortening of arms and legs became more apparent. As for the life expectancy and the intelligence, they remain unaffected, and most individuals with pseudoachondroplasia can raise families and lead a productive, active, and full lives. Pseudoachondroplasia differs in severity within and between families. At 9 to 12 months, when the affected person is starting to walk, the first sign of pseudoachondroplasia may appear as waddling, and this reflects an underlying skeletal abnormality involving the hip. Waddling is compared to duck walk or penguin walk. Also see here the redundant skin folds and laxity of the hands, and it is because of the shrinking of the bones. The joint laxity in the knees contributes to the deformities in the lower extremities, such as the genovarum, also known as bowing or spread apart knees, that we call sakang in our own dialect. Genovagum, also known as knock knee, wherein the knees face each other, and this is what we call picky in our dialect. Lastly, the wingstep deformity as the combination of genovagum and genovarum in each leg. Spinal abnormalities are also common, as pseudoachondroplasia have the mutation of the COMT gene that specifically affect the chondrocytes in the growth centers, which are the cells that specify for linear growth. We have scoliosis, or the S-shaped spinal curve, the lordosis, which is an abnormal inward curvature of the lower portion of the spine, and kyphosis, which is an abnormal front to back or outward curvature of the spine so that the spine is abnormally rounded at the top. In addition, we also have the odontoid hypoplasia, which causes instability in the neck region called cervical instability, hence increasing the risk of spinal injury called cervical myelopathy. Lastly, the most common and universal complaint in pseudoachondroplasia is pain, as the articular cartilage at the ends of all the long bones also contains chondrocytes that is easily eroded. Osteoarthritis in early adulthood is a universal finding, usually developing into arthralgia or the chronic joint pain that is specifically affecting the hips, ankles, shoulders, elbows, and wrists. The gene that is affected in pseudoachondroplasia can be found at the chromosome number 19, which is the cartilage oligomeric matrix protein, or the COMP gene, which provides instructions for creating proteins that play critical roles in many functions of the body. The pattern of inheritance is mostly autosomal dominant. These genetic disorders occur when only a single copy of an abnormal gene is present. The risk of passing the abnormal gene from affected parent to offspring is 50% for each pregnancy, regardless of the sex of the child. In some cases, act may also be in autosomal recessive manner or results of parental germline mosaicism for computation. One example is while the parent does not have the pseudoachondroplasia because the mutation is not present in sufficient number of body cells, but it is possible that one or more of the children may inherit the germline COMP mutation leading to pseudoachondroplasia. The likelihood of a parent passing on a mosaic germline mutation to a child depends upon the percentage of the parent germ cells that have the mutation. But most importantly, the research states that majority of pseudoachondroplasia cases occur as a new, sporadic, or de novo mutation, which means that the gene mutation occurred at the time of the formation of the egg or sperm for that child only, and no other family members will be affected. In this case, the disorder is usually not inherited from an affected parent. Treatments directed towards specific symptoms as they become apparent and usually require the coordinated efforts of a team of specialists who will systematically and comprehensively plan needed treatments. Specific therapeutic procedures and interventions may vary depending upon numerous factors such as the disease severity, the presence or absence of painful symptoms, an individual's age and general health, and the other elements. Pain medications are beneficial, especially in treating pain associated with the joint disease. Physical therapy is used to improve joint motion and avoid muscle degeneration. Surgery is especially for spinal abnormalities as they needed to be corrected. A drug named resveratrol, which is an stilbenoid, a type of natural phenol, and a phytoalexin produced by several plants in response to injury or when the plant is under attack by pathogens such as bacteria or fungi. The sources of resveratrol in food includes the skin of grapes, blueberries, raspberries, mulberries, and peanuts. This drug is one of the remedies for pseudoachondroplasia that is under clinical trial, and if successful, this drug will help to decrease the inflammation to restore long bone growth and decrease pain. According to my research, pseudoachondroplasia doesn't have a specific racial group target, as it affects all races equally, as well as in men and women. There is no exact prevalence rate of this disease, but it's estimated to be approximately 1 in every 50,000 to 100,000 births. To deepen our understanding, let us watch this
clip. Our son Grayson is a year and a half, and he's a super healthy baby. We know that he doesn't have my type of dwarfism, which is achondroplasia, but we don't know if he has pseudoachondroplasia, which is Joe's type of dwarfism, or if he's even average. But pseudoachondroplasia doesn't show any signs or symptoms until a child is around the age of 2. So the only way that it can be detected before then is having Joe see if his blood work matches Grayson's work.
Lifetime's Little Women LA is now in its 7th season.
And one of our favorites, Tara Jolie, joins us this morning as she's here to break some big but serious news about her youngest son, Grayson.
Hi, Tara.
Hi, guys.
Tara.
Always awesome to see both of you.
Aw,
It's been
thanks.
a while, I feel like.
It
Since
has
last
been a
time.
little bit. I mean, it's been like 2 weeks. No, I'm just kidding. Yeah, it's been a while.
But in that time, a lot has happened.
A lot has happened. We're in the midst of season 7 of Little Women LA, and a lot of people have been inquiring regarding Grayson because he resembles an average-sized child. Acons, when we're born, we look like, okay, I know that's an acon. They have larger heads, their bodies are the same size, their arms and their legs are a little bit shorter, but average size and pseudos are born exactly the same. So we had to have testing in order to find out if he was little or average. And we weren't going to for a long time, but we ended up deciding on actually having the testing done. And it's official that he is little. We are in a little family. And I'm really grateful for that. I know that a lot of people think that it may be a negative thing, but we wouldn't have had children if we thought dwarfism was negative. And I feel like being little has made me kind of who I am today. And so I'm proud that he's little, and I'm proud that we have a little family. And with all of the ups and downs that dwarfism does have, I feel like he's in the best environment to explore that.
He is
he is.
precious.
Thank you.
How did Joe handle the news?
I think honestly he could have said that he doesn't care one way or the other, but in all reality, you want a healthy baby, and I know that he himself has gone through a lot of surgeries. So I know that it's kind of a scary beginning, knowing that your son may face the same kind of surgeries that you went through. But overall, I think that he's totally comfortable with knowing that his son is just like him. It's like his little clone. He looks like his twin. And
so cute.
I'm so grateful for that.
So what kinds of surgeries? Is there anything preventative that could, that he could have in the next couple of years to help sort of his growth?
They're still doing testing on that, but it actually is something that is being explored. I don't necessarily think that that's a safe route for us, just because I don't, like I said, I'm really happy that he is little. I know that that's not the easiest solution in everybody's eyes. And the last thing that I want is for people to feel sorry for dwarfism, because I feel like at the end of the day, this has made us who we are. This is a part of our lives. Everybody carries the possibility of having a little person. And
It's like 1 in 30,000.
it's 1 in 30,000.
Yeah.
So I feel like it's a great way of showing that you stand out in the world, and how you stand out in the world makes all the difference.
Was there a conversation at home when the testing was going on with you and Joe? Is it something, would you like to debate it at the dinner table or talk about it at night? Or
Yeah, I mean, Joe immediately had the instinct that he was little, like from a while before we ever did the testing. And there's no real physical features that say that that's a little person, but because with pseudos, they don't stop or slow down their growth patterns until 2 or 3 years of age. So right now, he's in preschool. He just started preschool. Oh my gosh, that's so scary. Anyways, but he's in preschool, and it's so incredibly, or daycare actually, but it's so incredibly weird because he looks exactly like every other child there. And yet I know eventually that growth pattern is gonna slow down. And I just hope that I can be as involved in the schools and as involved in his life as he knows, so that he's comfortable with it. But it's scary. We would be like, he's average, he's little.